All right, Pat, thanks for hanging out with me. I appreciate it.
Yep, thanks for having me. Looking forward to the conversation.
So, I'm going to start this off with a bit of a snide comment, and that is I did not know that DAC bars went out in public and talked to other people.
This is a very rare occurrence, so don't expect it to happen again.
Listen, I thought the only reason you became a DAC bar is so you didn't have to go out in public and talk to people.
Well, that's a perk, I would say, but not the main motivation behind it.
So the funny thing is, like, I never considered being a DAC bar when I went to chiropractic college, and when I got out into practice, I it it turns out my introvert nature, like the being in practice, really rubs against being an introvert. And
Right.
I remember kind of thinking back, going, maybe that was a mistake. Like maybe I should have looked more seriously at being a DAC bar or doing something that didn't require so much human interaction because
Right, right.
it's exhausting as an introvert to constantly be meeting new people, putting your hands on people like that day to day. It really is exhausting.
And then conversely, as someone who saw patients for a number of years after radiology training, I'm very thankful for it. It really translates well to what you do in patient care and how you think and how you can best help people. So
You're talking about the radiology part.
radiology training translating to, yeah, day-to-day patient care.
So I was actually curious, like that's probably a good place to start because there's sort of this heated debate in chiropractic about the use of imaging. And I was kind of curious what your opinion of the matter was in terms of some people are like, never x-ray anyone ever unless they're just in the absolute most dire straits. They got a bone hanging out, or whatever. And then there's other people that are like, when in doubt, x-ray everything. And there's sort of like the two spectrums. And
Sure.
what is your thought on that? Like, when should someone take films? When shouldn't they? Like, what's too much?
Totally. Wow, what a great question. We could spend probably the rest of our time together just chatting about this topic. I think the framing of this question is really how useful is the tool and
Yeah.
what are the questions you're sort of seeking to answer, and do you understand the limitations? So X-ray imaging, radiography. It's widely available, it's low cost, and it's very specific. So what does that mean if you think someone has a fracture, dislocation, tumor, infection, the list goes on, and you see it on the X-ray? I mean, you've made the diagnosis. It's there for $25, whatever it is, and can change the course of care. Where a lot of people miss up is this over-reliance and over-confidence on how good X-ray imaging is.
Yeah.
If you think someone has pneumonia and you get a chest X-ray and the chest X-ray looks okay, they still could very well have pneumonia. So it's just respecting the limitations. And then the other limitations would be, what's the harm of over-imaging? From a safety standpoint, it's very low
Yeah.
nowadays. I mean, there's no real radiation, no meaningful radiation risk in a relatively reasonable sense. But the harms, of course, are increased utilization of imaging downstream. You got X-rays because you wanted to, and then you saw something that you didn't know what to do with it, so now you get an MRI to sort of clarify what you saw. And that's expensive. That's not cheap. And then false positive findings from that testing. The MRI shows a disc bulge, and that causes this whole spiral of healthcare utilization and over-testing and over-treatment. And
Yeah.
I would argue that a lot of that can be prevented just by good shared decision-making with the patient. If you're thinking about low back pain as an example, and you want to get lumbar radiographs on a 55-year-old with low back pain, it's probably appropriate to tell them that, hey, we're going to see arthritis in your back. That's expected. That's okay. How much might influence our decision making, but I'm looking for something scary, and if it's not there, great, we're going to help you. You're going to feel a whole lot better. That's sort of my take on it. I'm more in the center. I think if you're seeing patients that have a high enough complexity, so you're seeing enough people with enough diversity of presentations, you're probably going to be using X-ray imaging a lot. And if you're not, you should probably step back and say, am I doing the best? Because no one's good enough at the bedside clinically to just make these diagnoses. I mean, you need help. I mean, patient care is hard, and you need help. And X-ray imaging is a good start, I think, but it's not the only thing.
I always say about chiropractic practice, if it weren't for the people, it'd be easy.
Right. What do you think? I mean, is that reasonable from your perspective, or do you have a different take on
Yeah,
it?
no, my perspective is that if the imaging is, I liked what you said as far as like what question are you trying to answer. I think that if there's a question that could potentially be answered, like meaning if there's something you're going to see or not see on that film that's going to change what you do or don't do, then I think it's reasonable to do it. And I would also include techniques with that as well. So if for some reason an x-ray is going to give you information that's going to change what you do or don't do, even technique wise, which some like upper cervical techniques, and there's some techniques that do rely on imaging to a certain extent, then I think it's probably fine. If you're doing it just because someone told you you're supposed to x-ray everyone, or if you're doing it as a sales pitch, or you're doing it because you know you're going to see arthritis and you can make a better pitch or whatever, like there's all kinds of reasons not to do it. And so my opinion has always been, if that imaging is going to help you, then do it.
Right.
If it isn't, if it's just something you're doing, then I don't think that there's a point in doing that.
No, I agree. And there's clearly ends of the spectrum. There's unethical use, like you mentioned, the sales pitch.
Yep.
There's clearly obvious needs where it'd be unethical not to consider X-ray
Yep.
imaging. And then there's that middle area. And then even in the technique space, that's an informed discussion from my perspective with patients. Like, hey, I could probably help you without it. I think it's going to help you more.
Yep.
There's limited data to support that. Here's the risk benefits. And I understand it's nuanced and it takes a little more time,
Yep.
but I think that's sort of the appropriate way to go about it.
Yeah, I did a lot of upper cervical when I was in practice, and there is some imaging like that we take to like mark and do listings and stuff. But even that, and I know that I'm not like there's some technique people that are so hard on it, like they just it's like a gospel issue, that sort of thing. For me, it was always like the X-ray is going to give me a starting point for how I'm going to go about adjusting this person, but I always evaluated the X-rays and also how the patient responded pre and post adjustment, like how they did after care. Like to me, it was all just pieces of information. I never looked at the X-ray as like, this is how I need to adjust someone because that's what the X-ray says. Because I've always viewed X-rays as having certain limitations. It's only giving you so much information.
And you've got the patient at the center of it, right? And that's not a piece to be lost, because there's real harms of over X-ray imaging that are not so much physical as they are psychosocial, and that very contextual. And for example, if I show you a picture, an image of your cervical spine and point out arthritis and so on, it's less likely to improve your outcome. It's more likely to dampen your outcome. But if I show you a picture of your coronary arteries and show you that they're narrowed, you're more likely to have behavior change. It's the same principle, but it's a different outcome. So it's really interesting how contextual this conversation is. We have to be mindful of that to avoid like nocebo at the bedside too with patients.
Yeah, I think that the one of the interesting things from a practical standpoint of dealing with people is people don't know what's normal, and sometimes people can get so consumed by the fact that there is arthritic changes, or there's something on that film, and they're so obsessed with it, and it's like even someone that's like, oh, this is a normal curve, that your neck is straight, and it's like there's a world where like, hey, if you're functioning fine and it isn't textbook perfect, maybe let's not fiddle with it. Like if it ain't broke, don't fix it. And that's sort of to me like the practical aspect of care, where it's like, and the way I used to say it, the way I used to tell patients all the time, kind of my joking comment was, your body hasn't read the textbook.
Right.
So like trying to force you into a normal, just because that's like normal to me is like, let's get you functioning well within your body and within your reality. Let's not try to force a normal that may not apply to you.
I think that's really well said. I would summarize the topic, at least, of X-ray imaging in our profession, and not just our profession, healthcare in general. And this is probably a job for us as educators to take the lead on, is we just need to do better. There's been some relatively recent data where there's too much over-imaging of people who don't need it, but then there's also too much under-imaging of people who would meet the criteria to get imaging. So we're just doing it poorly as a cohort in healthcare, not just chiropractors, but primary care especially. Or primary
One
care.
of the things I think is actually interesting that happens within like the evidence-based chiropractic space is that they see something that like a wellness-based or somebody they would consider like a vitalistic chiropractor, they see something that they do and they want to throw it all out and be like, well, I'm not gonna recommend any care. Like I'm just because care plans are bad. They see someone doing like a 12-month or
Right.
like prepaid care plan and they freak out and say, well, I'm not going to make recommendations at all because I don't want to do that. Or then it's like they see someone X-raying everyone or misusing X-ray, and then they like the young docs who they overcorrect and it's like, well, I'm just not going to film anyone, and it's like that you can't throw the baby out with the bathwater. Just because somebody does something, they use a tool in the wrong way doesn't mean it's an invalid tool.
Yeah, overcorrect's I think a real good term. It's we need to stay humble and curious, and like we said before, I mean it's hard to care for other people, so we just need to stay open-minded, I think.
What do you think about cone beam CT?
So I don't see. I think it's good to limit radiation for the region in question. I don't think it's got a lot of indications for what I guess practicing chiropractors might use it for.
Yeah, because I know that I know some of my upper cervical buddies are like they're the only chiropractors that I know that are using it. And I've seen upper cervical chiropractors using it specifically for listings. And I don't know enough about it because that sort of came about. Like I closed my practice in 2013, and it sort of became more prevalent or more of a real world thing kind of after that point. So I've seen it, but I have no actual experience with it. And is that something that, like if a chiropractor sent something like that to a DAC bar, is that something that they would even look at, or is that somebody else's job?
That would be, I think, user dependent. You'll probably get different opinions from different DAC bars on that. But that, once you introduce CT, my comments about radiation being not really the main harm to patients are no longer relevant, because now you're introducing, even with some limit, measures, you're still introducing more significant radiation. So I would just urge everyone to proceed real thoughtfully with the use of CT for these sorts of questions.
Yeah, I think it's interesting, but I don't think that something being interesting is necessarily a reason to put it into practice. You know what I mean? Like there's this. I tend to be even like I'm not in practice anymore. I'm working in like technology space, but even within like marketing and technology, I tend to be like a slow adapter because I like to let things kind of let's see where this goes before I, apply it. And some people like to be on the cutting edge. I kind of see that cone beam CT stuff as like you're trying to be on the cutting edge of something that I don't know. I don't know if it's good or not. I actually don't know.
Well, and I think we need to be thoughtful. This happens a lot, not to fall in the trap of surrogate outcomes. The outcomes we're concerned with are, quality of life, function, pain, these sorts of things.
Yeah.
Over imaging and having overly sensitive tools for surrogate outcomes that may or may not be important is oftentimes a trap.
So when I was in practice, I had basically my philosophy of films was my job was to rule out the oh craps. Like that's kind of like how I put it, where it was like, if I couldn't rule out an oh crap, I'm not really sure what that is, then I would send it to someone else. I'm in the St. Louis area. So like I would send my stuff to Logan and Kettner or somebody over there, Dan or somebody would look at it and kind of give me the thumbs up, thumbs down. Is there a criteria that you like, some sort of like, hey, this is the criteria chiropractors should use when it's like, hey, have somebody else look at it, like if when in doubt or whatever?
Yeah, it's a really good question, and there's going to be a wide range of skill set, of course, practicing chiropractors and comfort level with image interpretation, X-ray interpretation. The most conservative approach is just to always have a professional look at it, right? But if that's not an option, or if that's not a route folks are looking to go down, then definitely rely heavily on your clinical suspicion. If your base rate going in was a clinical differential that was one of the OCRAPs, tumor, infection, fracture, etc., and you don't feel 100% confident, then you'll definitely want a secondary opinion. But
so do you recommend that people just if have a have somebody look at it all the time? Is that what you would say is your best recommendation?
Yeah, 100%.
Okay. Let's talk about, actually, you know what? I'm going to bring something. I was going to bring this up initially just for the pure fun of it. And then we'll talk about your new job because we're going to talk about that. I cracked a joke. So I do these dumb memes about chiropractors on Instagram. And I cracked a joke about Kettner recently. And it was a very specific thing. But I want to ask you, are you aware of the staff talent contest that he was in?
I am aware of it.
Okay, because that was the joke. The joke was about that. And I was surprised that was not kind of more widely known by, because I feel like that's something it's your duty as a Logan student, if you become aware of that, to like tell the next class, hey, just so you know, Kettner rapped at a talent contest and it's glorious. And I just wanted to know if you were even aware that existed.
I was aware, and he's my mentor and mentor to many others, and just a real force in the profession. But someone with a really approachable human side, so rapping and otherwise.
I'll tell you what, and I'll actually say this, and then we'll kind of move on. I never had him as a mentor. I had him as an instructor, and I think he's a hard instructor. I think he's a difficult teacher in terms of like he's a hard grader. He has a high standard. And when one of our friends had found that, and they actually played it during class, like they didn't tell him, and they loaded it into the thing, and it like was on the projector, and they played it. And when I saw how he reacted to it, where he just thought it was funny, and then after that, I saw these little cracks of like how like approachable and kind of funny and interesting. Like I think he's very different, and I'm saying this from a distance, but I think he's very different from as a human being than he is as a teacher. And it was actually kind of nice to see that it's like, oh, hey, there's a human.
At times he's human. He's very rigorous, has like you mentioned, high standards, but you're right, he's very practical as well, and humble, and rare combination for sure.
All right, so let's talk about the new job. So you went out to Western States. Your job is VP of Community-Based Clinical Education. Did I get that right?
Yep, perfect.
Let's talk about what that is exactly. It's kind of, so sometimes job titles sound like word salad, but it's like tell me what that is exactly, and what are you doing now?
Yeah, really excited to be here working with this team. So community-based clinical education, it's a distributed model of clinical education. It's the same thing effectively if you want to lump it into other categories. Think of like internship, preceptorship, but just trying to be a lot more intentional about how we identify and cultivate sites for our students, B, how we engage students early in the process for good matching effectively for really good experiences. And then also other things like how we develop sites, how we support them while they're there. And we're very involved, very present. It's distributed, like I mentioned. So we've got students, like a new cohort just started, and there's students obviously all over the greater Portland area, Southwest Washington, but Vancouver, British Columbia, Edmonton, Calgary, in Alberta, and then on the East Coast, there's students. So it's really distributed, which is nice. And it gives students a lot of geographic flexibility, lets them either explore good opportunities or relocate maybe back home and save on the cost of education. Also gives them opportunity to engage in small practices, multi-site clinics, or big health systems, the VA, private hospitals, community health centers. So it's a really diverse portfolio that they can engage with.
How does a clinic kind of get on that list? You know what I mean? Like if a student says like, I want to go back home, but there's nobody back home. Like how does that even take place? Is that something that gets proved through the school?
It gets approved, and really, so there's a few different entry points that all converge in a common onboarding process. So one is like we'll identify sites, word of mouth, and we're a small profession, so you get to know each other and know who's high quality. So that's one, is the university will identify and develop sites. That's especially true of like big health systems. So think of like our VA affiliations.
Yeah.
And then for individual private sites, like you mentioned, that happens a lot where students say, I've got a chiropractor back home. I'd love to go back there these last 6 or 9 months because I'm going to take over the practice and I really want to learn all those practical aspects. So I'm ready to go when I get licensed. So that's great. So that's not a limitation. It's just a matter of that site needs to be comfortable and willing to engage in our onboarding processes, which aren't overly intrusive, but it's not nothing. It's, a meeting, whether in person if appropriate or virtual. It's some materials on clinical education and other compliance related items, with the goal being we want a successful experience for both. We want, when you as a practitioner receive a learner, you're comfortable, your practice is comfortable, your patients are comfortable. And then when students enter these spaces, they're getting a high level of education in addition to all the practical experiences that only these sorts of sites can offer.
Are there red flags like that are just things that somebody comes, somebody comes in, they say, I want to work with, my chiropractor or whatever, and there's something that's said or something that's done, and you kind of go, this isn't a good fit for what we're doing?
Yeah, I think obviously there's compliance related issues. You have to be licensed, good standing, and no board actions, these sorts of things.
Yeah.
But other than that, it's an unwillingness to provide education. The old model, and this probably still exists, of preceptorship, especially in our profession, is students come into a practice and they have limited oversight at times, or they're just kind of, they're meant to do their own thing a little bit. That's an old model, prior state, but that might have been the training that some of these now current doctors have been exposed to. So whereas the current model, the current state, is more oversight, more supervision, greater autonomy, of course. These are soon to be professionals. They need to have some more autonomy, but folks that are unwilling to provide the level of education we're looking for, that's not usually a red flag, but definitely a yellow flag.
What is the because like one of the things I deal with, because I work with a lot of chiropractors that are getting started and like with their own practice, and a lot of chiropractors are doing like micro practices, getting started kind of by like a solo type thing or whatever. And when I have a doc that I'm working with that has been an associate, I'm always surprised, because I was never an associate, and I'm always surprised how like there's this disconnect between what they think they're going to learn and what they learn. And maybe that's what you're talking about when you talk about like kind of that old model and limited access. It's just, it seems like they'll go to associate settings and maybe even like, they get in there and they'll learn certain aspects of like patient care and patient communication, but then like all the things that you have to know about practice, like they seem to just not be exposed to that, or not even ask, or not even know to ask. And I feel like so many chiropractors that get started are so unprepared to take that task on of like doing their own practice. Like, is that sort of what you're talking about? Is like making that better?
Of it. That's definitely part of it, and that's a big opportunity cost that we're very intentional about not having our students go through, and it's obviously a continuous work in progress. But as an example, the onboarding meetings that we do with doctors, one of the things I say all the time is one of our expectations is this is an immersive learning experience. So it's not our expectation students go in, they just do their own thing, and they're just doing histories and adjusting patients. But we want them to spend time with the front end and learn the back end. We want them to get a full immersion into what it means to operate a practice. And then we're backstopping this even further. We're building out some modules for our on-campus clinic to have effectively what you would think of as like insurance claim processing and denial. Even if you're running clinical operations in an academic setting, it's very rare students are exposed to that level of detail when they need to be, because they're going to be responsible for it, and it's going to really benefit them. One of the biggest benefits of the community-based program is it gives students hopefully that experience in a jurisdictionally appropriate setting. So billing in British Columbia is different than billing in Oregon. So learning that while you're a student, I think is critical and really sets you up for more success if you're motivated and you're intentional about what you're learning and you continue to stay engaged. You can really set yourself up, I think, for a successful early career.
Yeah, even from an insurance standpoint, the style and type of practice you do changes insurance billing. So you could have like a general knowledge of insurance billing as a, adjustment only chiropractor, and then you get into a setting where they're doing, other therapies and stuff, and it completely changes. Or it is, and like state to state changes. Like it's so complicated, and that my thought. There was a part of me when I got into practice that realized, because I started my practice right out of school, and I was blissfully ignorant. It's just, you know what I mean? Like I knew I was going to be great because I'm awesome, whatever. And then you get into it, and it's like 6 months later, a year later, and you're just struggling. I mean, you're just trying to pay the bills and get your head above water, and you're drowning, and you have that humility of realizing, like, man, I need help. And I went through this period where there was a little bit of an angst against the school, where it's kind of like, I'm not prepared for this. And I've really softened my feeling about that, because I feel like the school's primary job is to get you to pass boards and to get that, there's so much. And I think what you're sort of doing here is trying to maybe fill in some of those blind spots or some of those spots. But I'm pretty convinced that there's no possible way. There's no scenario where schools can completely prepare chiropractors for all the different aspects of being a chiropractor, because it's so complicated.
I agree with that part. I do think that is should be our goal, though. Like that's where we keep working, and we may never get there. I understand, because things change and health systems change and people's preferences change. Totally understand all that, but we can always do a little more than we did, and always be a little more intentional about is the level of education we're providing today, is it preparatory for our graduates in 2026? Yes, they need to pass boards to get a license to be able to practice. That's a non-negotiable. But then after that, the more intentional we are about filling in those other holes, the more we can just enable early career success, which I think is everything, because you want to stay engaged early, you want to be successful early. That's going to sustain you for a good career later.
Do you have, does you personally, or even Western states, have an opinion about what you recommend for students that graduate? Like, hey, if somebody came to you and they said, I don't know, should I be an associate? Should I start my practice? Should I try to do this? Should I independent contract? Whatever. Like, do you have an opinion on what people should do, or is it an individual thing?
Institutionally, we don't have an opinion that I know of. I don't have an opinion either. I will say we, in our community-based program, we start the planning process early with students. So we're a quartered system for context, and quarters 10, 11, and 12 are the last 3 quarters, so last 9 months of a 3-year program where students can go off-site. In quarter 5, 6, 7, we start having these conversations about community-based placements. What does it look like to you? And really just encourage students to think critically about what does success look like for you early on. Because for different people, some are more entrepreneurial and they'll thrive more in a private practice setting. Others would thrive more in a retail health environment. Others would really only thrive in an integrated health system. So I think it's very different, which is great. I think that's one of the great things about being a chiropractor is there's some diversity of like where you're going to be at in the health system and what you can do. So I think it's dependent on the person, and just trying to give them those principles of it's going to look kind of like private practice, integrated system, etc. What do you think, and what sounds really interesting, and what's really resonant with you?
Yeah, I was when I was early in practice, like I sort of had like a very dogmatic opinion of like what chiropractic is. It's like, it's like, and chiropractors can be that way for sure. It's like the way I practice chiropractic is the way that chiropractors should practice chiropractic. Like there's sort of that feeling. And one of the things that's changed since I've been working with chiropractors is I've gotten to see the different ways and kind of this mosaic of chiropractic, and say, like, I think it's a beautiful thing that there's so many different ways that people can practice chiropractic, and that people can benefit from chiropractic as a consumer, like as a patient. And I have become a much stronger advocate of excellence than I have about specificity of technique. And I'm like, hey, whatever you do, be committed to being great at it. That's more important to me personally than a specific style or philosophy of chiropractic.
Yeah, I really like that. I think, you know, there's some core principles that every chiropractor needs to be good at. You need to be good at talking to people, you need to be good at making clinical decisions, to be good with your hands, whatever that means to you in terms of the techniques and so on. And then other than that, you know, there's a lot of diversity as long as you're grounded in being patient-centered. Like, are you doing what's best for patients? Are you prioritizing their preferences and values? Yeah. And are you doing good and to the best of your ability and not harm? You're right. There's a lot of diversity in how you might approach patient care.
So one of the things I think is sad about the chiropractic profession, and I want your opinion about this because I think this is sort of in your wheelhouse as far as things you're probably thinking about in the future. One of the things I think is sad about chiropractic is that there's not, it seems like the opportunity to make the kind of living that I think most chiropractors would like to make. It almost forces most chiropractors to be entrepreneurial when I think that there's only a certain percentage of people that are. And the opportunities to have a job as a chiropractor. And I'll use my wife as an example. Like, my wife is a nurse practitioner, and when she became a nurse practitioner, like her and I sat down and we were talking about these job opportunities that she had available. And I laughed because I told her, I said, I would have given my left kidney to have like the worst job offer that you've been offered. You know what I mean? Like, it's like this does not exist in chiropractic where the benefits, the pay, the like this sort of thing that's readily available in her world isn't available in ours. And I think that's a shame, not because I love the entrepreneurial aspect of chiropractic, but most people don't, or not. I wouldn't say most, a lot of people don't. And so what I think is a shame in chiropractic is the infrastructure doesn't exist where you can get out of school, get a job as a chiropractor, working for somebody else or working for an institution or whatever, and making a good living as a chiropractor. And I think that's stuff that you're probably thinking about and you're probably kind of mulling over. Like, what is your thoughts about how to change that?
I mean, we think about that all the time because, you know, we continue to maintain an obligation to our students that, you know, as they enter the workforce, they'll have good career options. And, you know, and I'm being genuine when I say I think that is true. And I'm being genuine when I say that it's a much better place now for someone entering, I think, than a decade ago. At least, you know, what we see, what we hear as far as not only salary projections, but also just opportunities and opportunities in different spaces to be an employee, a salaried, benefited employee. Yes, you won't be making as much as someone who has that entrepreneurial drive.
If they're good at it.
You know, yeah, right. Fair enough. But it won't be nothing. It'll be meaningful. It'll allow for a good quality of life, especially early on. So I'm really optimistic in that. And, you know, one of the reasons providers engage with our program is because they're looking to hire chiropractors, which is great. And they're looking to do it in a way that I think is appropriate and ethical with, you know, reasonable offers and that sort of thing, and they're doing their diligence to make sure it's a good fit, which I think is a win-win scenario if it works out appropriately for both. So I probably feel this way in part because I am in chiropractic education administration, but I am optimistic, you know, for where things, for the potential that exists. Have you seen a positive increase in the past, say, 5 years, 10 years for chiropractors entering the workforce? Have you seen that change? Is that your perspective?
I would say even the existence of a place like The Joint, which I know a lot of people crap on, but it's like a place like that didn't exist back in 2004 when I was graduated. So I think that there probably are franchises and different things that are available there that an associate could get a better job. I mean, I had one of my clients was an associate that now he was in a unique situation because he was an associate that was running a clinic by itself. So it's like your income potential is very different when like you're running a separate clinic, and he's doing it at a high level. But the amount of money, I mean, I know how much money he makes. And I was like, wow, I didn't know associates made that kind of money. Like, that blows my mind. And it actually was we kind of jokingly called it his golden handcuffs, you know, because he sort of wanted to do his own thing. he definitely had the skill to do it, which is why he was doing so well in this clinic setting, but it would have forced him to start over. And I told him, I'm like, bro, I don't know what I would do if I were you, because he's got quite a bit of autonomy, not as much as he would have, obviously, if it was his own thing. But you're running a clinic, it's doing well, you're making a really good living.
Yeah.
And I actually, on the flip side of that is, like, that's a good thing. It's a good thing that those things exist. Great. And I would just like to see more of them. I would love, and I don't know if it would be in a hospital setting or if it's a clinical setting or multi-site thing or franchise. Like, I don't know what the setting is, but I would like for there to be, 40-50% of chiropractors, if they wanted to, have the opportunity to just get a job and be a worker bee, because I think a lot of people are worker bees and that's just what they want to do.
And I think it's all those settings. I practiced inside of community health centers for a number of years. And, when I first started seeing patients, I heard nothing about patients going to the Joint or going to Chiro One. By the time I finished, it was not uncommon to have patients who were also going there and speaking just fine about their experience. Yeah. So I think it's a rising tide for the most part, that it raises the profile of chiropractic and, maybe increases the demand in other settings that are more appropriate for that person. Like, what was appropriate for me was being in more of an integrated setting. My background and training set me up for that. But that's not everyone. I totally get that. And I'm with you, and I think it's going to be all of those spaces that you highlighted earlier.
I actually think that about, this is kind of a sidetrack, but it's like I actually feel that way about Instagram chiropractors and YouTube chiropractors. And I know that, like, I had a very negative, like, back crack, they're like bastardizing the profession sort of feeling initially. But the more I look into it, I go, I think if we're bringing the fact that chiropractic can help people, and that it is a viable option, if we're bringing that to people's awareness, I think that that's good. And I know that there's bad with it and there's a bunch of stupid stuff that goes along with it. I get it. I get it.
I have a slightly different opinion, but
no, tell me your opinion, because listen,
I just think that, that from my opinion now, we've crossed over a bit into misrepresenting perhaps the reality at times about practice. But
listen, I don't disagree. Let's have this conversation real quick. So I don't disagree. So my opinion initially was, this is garbage and it's not helping the profession. It's an absolute, we're making a joke of the profession. I did a deep dive into, like, the most popular chiropractors on Instagram, on YouTube, stuff like that. I looked into it, and my conclusion was shockingly different than what I thought, because I thought this is a clown show. Like, I expected to be embarrassed, and I was forcing myself to, like, cringe through this nonsense so I'd have content to talk about. And I was shocked that I thought, you know what? I think there's probably more good than bad. And in the same way that there are chiropractors who misuse x-rays for a sales purpose or for whatever reason, there are people that misuse social media from the standpoint of having scantily clad people, or like they're just doing it as a stupid show. It's an attention whore thing. It's not good. But there's also some really good chiropractors that are really popular, and you could tell just by watching them, they're good with their hands and that they're good at what they do. And I think that if that's causing people to see it and they think to themselves, I might need that, or I think I want that, or that might help me, it is doing that. It is causing people. And the chiropractors, I'll tell the chiropractors that don't get upset with someone when they show up saying, like, I saw this on YouTube and, like, I want to get adjusted. You can kind of, like, reshift them a little bit, but it's like they've showed up. They know they want something that you have to offer. And I think there's something about that that's good. I agree that there's a bunch of crap that goes along with it.
Well, and I'm not as informed on this as you are, so I don't dispute that. I think I don't even have an Instagram account, so
you're better off.
So I'll take your word that there's a higher quality, and maybe it's just maybe there longer term is an opportunity for a little tighter regulation around some of the really extremes that we've probably seen, but yeah, I'll concede if
100%.
If there's good quality stuff happening and it's raising the profile and exposure, then maybe there's some merit there.
Well, maybe here we'll end with this
my
word
mind went to the worst things we've seen.
Listen,
right?
I'll offer you a word of encouragement, and this is me. Like if I was talking to me 5 years ago, I would be in your position. I would say this: my word of encouragement is, on the surface level, as a chiropractor who cares about the profession, on the outside looking in, it looks worse than it actually is. When you dig into it a little bit and you kind of look into it, you see it and whatever, you're always going to see the clowns. There's a bunch of clowns doing clown stuff, and they're just doing it for attention. And that's like, I get it. Like, you're using a hammer and a chisel and you're adjusting someone that's like half naked. Okay, this is stupid. And so, but mixed within that, there is
not
actually
taught in institutions either, to clarify that. Not taught, at least at the institutions I'm aware of, not taught.
Yes, not taught. And so there are a lot of shenanigans, and I agree that the shenanigans get attention, just like all shenanigans do online. But I do think, I was surprised, and I would just say this: I was surprised to see. I think that there's some good laced within the stupidity and the clown show. And I was surprised to say that at all, because I expected it to be a nothing burger for me. And it turned out to be like, actually, I think this is not as bad as I thought.
Bold statement, but I'll have to maybe take a deep dive someday and see if I share that opinion.
I don't know that not as bad as I thought is a great compliment, but it's
right.
Not as bad as I thought. So
fair enough.
All right, let me ask you this. I was going to ask you about insurance, because I have a lot of thoughts about insurance, but I think that if chiropractors are going to have those jobs that we talked about, like, there's probably a world where insurance has to be better, or there has to be some sort of probably help with insurance, I'm thinking. But I also think that because of the frequency of visits with chiropractors, insurance is a little bit of an administrative nightmare for insurance companies. Like, chiropractors sometimes think that insurance companies have a problem with chiropractic, and I think they probably have more of a problem with the administrative aspect of it, and like the frequency and the number of codes and things of that nature. I've heard people talk about possibly doing like case billing, where it's like a per case basis as opposed to a per visit basis. Like, what are your thoughts about the direction that insurance is going to go, and is there any kind of hope for the future?
So yeah, I'll preface by saying definitely not my area of expertise, and obviously a really complicated and loaded area. The last thing you mentioned is interesting, though, this thought of, value-based payments, and whether it's just a quality incentive for what you're doing, which still puts you in that fee-for-service model, versus, like you mentioned, a bundled payment. If you're getting a knee surgery, there's bundling of all the PT you get with that, just as an example.
Yep.
Workplace, occupational health programs have a lot of that. And then capitated payments, where you're just paid to effectively care for a population, whether or not they come in and see you. It's obviously naively very exciting for chiropractic as a profession to be included in those latter two, especially, where you get reimbursed more so for quality and outcomes than you do for things. And but we're probably a ways off from that.
I kind of, it's one of those things that I don't have a tremendous amount of hope for, but I also look at it and I go, I would just say this: I don't have a lot of hope for it in the way that it's currently being done, because when you connect care with visits, and the only way for a chiropractor to get reimbursed well for what they're doing is the added visits, I think that you're kind of just going down the wrong path.
Yeah, it's a misaligned incentive for sure.
Yeah, because it's like more. I just had that issue with lawyers that I work with when I was in practice, and they would always get annoyed with me that my bills weren't higher. And I was like, but I don't know how to do this. Like, I don't know. You know what I mean? It's like, I don't know. Like, I'm billing everything I possibly can, like, legitimately. Like, don't get me wrong. I'm not trying to have low bills.
Right.
But it's like, if they don't need to come in more, I have a problem with, kind of ethically have a problem with having them come in more just for the sake of doing it. But there's no way to raise the bills without them coming in more. It's like, and that's sort of the trap I think you get into as chiropractors when your fees are connected to a visit.
And I'm thankful for the researchers in our profession for continually pushing to demonstrate efficacy. It's going to take a long time for that to pay off. But that scholarship will infuse into some of this change in the fee for service. When you show, when you show even, the benefits of what you would consider like maintenance or wellness care, it's got a little bit more stricter definition. But as that data becomes more available, then the reimbursement potentially could follow. But without that level of scholarship, it's a lot harder case to make. So I'm really thankful for the work all of our researchers are doing and need to continue to do a lot, because that's really the language that a lot of other policymakers will talk in.
I find it very frustrating, the whole insurance thing, just because I kind of feel like anytime we do something positive in that sense, chiropractors manage to ruin it because of it's an efficacy issue. Like there's that percentage of chiropractors, and I don't think it's representative of the whole profession, but there's a percentage of chiropractors that they're just going to take advantage of any good thing until it becomes not a good thing. And it seems to be, I'm sure it's not just chiropractors. I'm sure it's lawyers. Absolutely. And this is not a slight on the character of chiropractors. It's probably a slight on the character of human beings, but we just ruin good things.
And in general, I think, you're right in that in general, I think we're really good stewards of our patients and our patients' dollar, in fact. And I would wager that there's more chiropractors effectively giving away services than are overbilling services.
Yep.
But you're right, it's the small number, like any group, chiropractic, medicine, law, what have you, that's going to overrepresent things, because a lot of the chiropractors I know and talk to, they'll do extra things, and they'll go above and beyond, etc. And we're really good, stewards of our patients and their resources.
One of the things that I talked to somebody recently about that I got really excited about, because I talk about a lot about business and marketing and stuff in my podcast and things like that, is that being a chiropractor is awesome. And I know that there's downsides of it, with like the income potential and sometimes like getting out of school and getting that momentum going and getting your career going. Like, I know it's not the easiest profession at times, but there's this thing in the profession where chiropractors are kind of insecure about being chiropractors, and I don't get it. Like, it is so, you can make such a difference in someone's life by being a good chiropractor and putting your hands on someone and literally, I don't want to say changing lives in some sort of weird fluffy way, but my gosh, right. It's so awesome being a chiropractor. And I do offer, when somebody talks to me about becoming a chiropractor or they're getting started or whatever, I typically tell them, look, it's not easy. I don't think it's an easy profession, but it rewards you emotionally and kind of in sort of a purposeful way that a lot of professions don't. And I think it's a shame that chiropractors aren't more secure and comfortable just being a chiropractor.
Anything that is really rewarding, definitely is not going to be easy. So yeah. I agree. The satisfaction, I think, in general is high, and you could probably run experiments where chiropractors are integrated into big health systems, and their satisfaction will be towards the top, I would mention. And part of that is because patients in general are really satisfied. So when there's always difficult cases, and as a pain treating clinician, that comes up not infrequently. But in general, it's very nice when you go into a clinical day and 80% of your day was spent with people who really like you. That's really cool. That's that goes a long way to making things feel good, right?
Listen, the people that are most vocal about hating chiropractic don't go to chiropractors.
Right.
Because the people that go to chiropractors generally love the experience. And even when they're going to someone that we necessarily be like, oh, that guy's kind of a hack, it's like, you know what? His patients aren't unhappy with him about the care. Now, sometimes people are unhappy about how they were treated by the staff, how they were treated by, like someone's billing practices or someone's, right. There's a lot of reasons why people are unhappy with their chiropractor. Clinically is not high on the list.
Yeah. Yeah. No, I think you're right.
So tell me this, as we wrap this up, where do you see, what are your thoughts about chiropractic in the future? Just sort of kind of an open-ended generic question, but it's like, where is chiropractic in the future? What's your thoughts?
I think my hope, at least, is chiropractic continues to be integrated as part of a patient-centered healthcare team. I think we have expertise in the space of spine and musculoskeletal management. We're not the only ones. But I think if you were to put a team of doctors and other healthcare providers together, we should be some of the early points of contact for anyone who has a spine or musculoskeletal disorder. That's one. I also think, and so I think we need to be part of the team. We need to be viewed as experts in that space alongside other disciplines who have similar expertise. We need to be seen as being the go-to providers for the provision of conservative spine and musculoskeletal care. And then also we need to be given a voice in a healthcare team that emphasizes prevention wellness on one end and then chronic disease management on the other. I think both of those are important, and I think both of those require a multidisciplinary approach as well. So
there's a wellness aspect that has kind of always existed in chiropractic, and sometimes chiropractors that are more kind of philosophically on that side of things, they'll say stuff like, people think chiropractic is only about back pain. And my response to that is, no, they don't. Like, we haven't even done a good job of convincing people of that. And if the population as a whole was convinced that when they, like, the chiropractic is a valid, good kind of early use, like treatment, for back pain, like, we wouldn't even have a new patient problem, because like 80% of people have back problems. So I always think it's frustrating. It's frustrating to me when it's like, I think sometimes chiropractors, because they really love the wellness aspect. And I really like the wellness aspect of chiropractic. Like, don't get me wrong, but I don't think the wellness aspect of chiropractic is the low-hanging fruit. I think the low-hanging fruit is you work with the spine, we work with the muscles, we work with the spine. Like that should be the thing that we are well established as, like, we are great at this. Like, you have that problem, you see us first. Like, it makes no sense for you to see anybody else, like, first. And like, I wish that we did a bang up job of that. And then some of those, like, kind of, I call them off-label benefits of chiropractic. Like, some of those things, we can have that discussion later, and we can introduce like wellness concepts and things like that to people later. But I don't think we've done a good job of just getting people to understand that we should be an early choice and a first choice and oftentimes a best choice for those
only
muscles.
choice for a number of spine and musculoskeletal disorders. And if we're part of a team that embraces that, that'll be to our benefit. It'll open up more diverse patients for us to see and help us understand our limitations and how we can co-treat with team members. And then also, back pain, shoulder pain doesn't occur in a vacuum. There's, especially if it's chronic, a layer of psychosocial complexity that involves wellness and counseling and disease management. And we could really continue to do right by our patients by adopting a team-based approach while we lean into being, physical function experts, right? Most chiropractors, most of the time, help patients feel and function better, and they help them do it pretty quickly, right? So I think we share that opinion.
I'm going to leave you with just open floor. Is there anything you want to say as far as people getting connected to you? Anything you want people to check out that you're doing? Anything like that? Kind of the floor is yours.
So at the University of Western States, we talked about our community-based clinical education program. Always looking to continue to collaborate with like-minded, student-focused doctors. I don't know if there's an opportunity to provide our link in some of the show notes or similar.
Yep, we'll do that.
Definitely, there's an application link, or you want to have a call to talk more about the program, please take advantage of the links available for that. At UWS, we've got a really unique portfolio of programs that we're trying to integrate in how we teach students. So we've got chiropractic, of course, naturopathic medicine, mental health counseling, sport performance psychology, nutritional programs. So we're really trying to be thoughtful about how our students get a really integrated education and touch points with these different programs. So I would just say, if you'd like to collaborate more on what integrative care looks like as well, maybe you're not ready for participating in the CBCE program, but you've got unique ideas about how you think integrative care should be executed, just reach out, and love to brainstorm that a little more as well.
Awesome, man. Well, hey, I enjoyed the conversation. I thought
Likewise.
It was some good information and a lot of fun. I appreciate you coming on. Thank you.
No, thanks for having me, and we'll talk soon.
Yep.
See ya.